tell us your name and where you live.
Louis Martin, Paris.
Dr. Andrew Lambert, Paris.
What are you planning to do today?
I'm scheduled for a blood transfusion in a hospital to restore my blood measurements.
I will see maybe 20 leukemia patients today, some long-term inpatients and some daily outpatients.
Why does Louis need a blood transfusion?
I have acute myeloid leukemia, and for 2 months I've been having treatments.
Louis had induction chemotherapy for a week and is now having consolidation chemotherapy. If we find a maintenance therapy, Louis might be on that for months or years. If not, our team here is looking into other options.
How do you feel about today?
I'm always very tired and have several side effects. I'm often in and out of the hospital. My family and I feel we are going through hard times and are fearful for the future.
I am hopeful we can find the right medicines and treatment plan for Louis.
Are there people you count on to help you every day?
Yes, my doctor and the nurses, and I'm so lucky to have a caregiver in my family.
Of course, the nurses and I collaborate about Louis with other doctors here and at other hospitals.
Do you get discouraged at times?
Yes, it's easy to be discouraged and afraid, but my family and I try to be hopeful.
10 years ago, acute leukemia did not have many treatment options, and it was very hard on the patients and on me not to be discouraged. Recently, new treatments become available each year and offer new treatments and more hope for some patients.
What does the future hold for Louis?
Unless my treatments start to improve and maintain my blood count, I was told I might have to be scheduled for a transplant of some kind. And this is a last resort, I am told.
Louis's leukemia does not have a mutation with a less intensive new drug combination treatment option. We have used standard chemotherapy, but he has complications and his condition is not yet improving.
How would a transplant help?
Removes my bad blood cells and replaces them with good cells from a matching donor, or fixes my own cells.
We have found a compatible, healthy bone marrow donor and may replace Louis's bad blood and marrow with the donor cells.
Is this a long and hard process?
From what I see on the internet and hear from my doctor, it can be difficult and maybe not successful.
Yes, a transplant can be a long and difficult process and is not always successful. Our hospital has a collaborative AML team and we are looking into new options for Louis. If we find something very soon, we can avoid the transplant.
What are the benefits of a transplant?
It might make my leukemia go away and for a while, maybe forever.
The success of a transplant depends on many factors: mutation type of AML, age, other health issues, correct donor, but it can remove Louis's leukemia if successful. We are still hopeful the current consolidation treatment will work for Louis.
How has leukemia affected your life?
Leukemia has completely upset my life. As I go through intensive chemotherapy and so many other treatments for my side effects. I cannot work or participate in most physical activities. Our finances are at risk and even our family responsibilities are all changed. I am tired and have nausea and digestive tract issues. We cannot have visitors because I have a compromised immune system and low resistance to infections. Yes, our lives have been terribly affected by leukemia, and we do not know if we will ever return to normal. But we have no choice and try to keep hope for better times.
Every AML patient has a different path. My mother died of leukemia 25 years ago, so I decided to become a doctor. Within the past 10 years, we have begun to think about our patients not only in terms of survival, but also in terms of quality of life. That is great progress.